Hey, Dr. Labutti, can you tell us who would benefit from hip arthroscopy?
Well, there's a number of people that can benefit from hip arthroscopy. There's a condition called femoral acetabular impingement syndrome where bony growths on the neck of the femur or thigh bone in the hip joint impinge on the acetabulum or socket. And the symptoms are groin pain and pain with certain positions of the leg. Sometimes it's associated with a labral tear. That's the other indication for hip arthroscopy, is a labral tear of some kind. People with femoral acetabular impingement syndrome sometimes don't have labral tears, but a lot of times they will. Some other indications are for loose bodies. If somebody has a arthritic condition in their hip and a piece breaks off, you can go in there and fish it out with the hip scope and not do a big open incision. People with a condition called osteochondromatosis. These are little cartilaginous, bony things that form in the lining of the joint. They're tumors basically, but they're benign tumors. And arthroscopy is helpful when trimming those out. There's a number of other things that can be beneficial. Sometimes if somebody gets a hip infection, older people who are ill, they can get a hip infection, and instead of doing a large incision to wash it all out, you can just put a couple of small incisions on the hip and wash it out with some water with a hip arthroscopy. That's typically what is used, what's typically used for loose bodies. Sometimes fractures. If somebody has a fracture of the ball of the head, a ball of the hip or the head, you can go in and get that fracture reduced and put a small screw into it and hold it into place. That way you don't have to do a large incision as well. So the incisions are about 1 centimeter, maybe 1.5 centimeters in size, 3 or 4 of them positioned around the hip joint. Typically the surgery can take as long as 2 or 3 hours depending on what you have to do with it, but usually 1.5 hours to 2. But sometimes people will go home, other times they won't. Depends on how long you've been under the anesthetic and how long the surgery was, how difficult it was. Sometimes an overnight stay is beneficial. But those are generally the indications for hip arthroscopy.
All right. Thank you, Dr. Labutti.
You're welcome.